Today, we are pleased to feature Audiology Innovations and welcome Dr. Carrie Scarff. Dr. Scarff is a registered audiologist and has completed her Master of Science in Audiology at Dalhousie University. Clinical audiology internships at Georgetown Medical Center in Washington, D.C., and the IWK Grace Hospital in Halifax, and her PhD and postdoc in auditory behavioral neuroscience at the University of Calgary in the area of brain plasticity and hearing science. She has publications in the areas of early identification of hearing loss and auditory cortical plasticity following hearing loss with her colleagues at the University of Calgary and Dalhousie University. Dr. Scarff currently practices at and leads her multi-site clinics Audiology Innovations Limited in the Mission, Glenbrook, and Mount Royal areas of Calgary, as well as Carstairs, with her talented colleagues. Her clinics offer convenient mobile clinical care for patients with mobility and transportation issues. Dr. Scarff was a long-standing board of director with the Deaf and Hear Alberta nonprofit organization in Calgary, providing resources and audio advocacy for those with hearing loss in southern Alberta, and is frequently invited to educate and inform healthcare professionals, the general public, and government agencies about hearing loss issues, new research, and treatments. She takes a particular interest in brain plasticity and leading edge advancements in hearing loss treatment. She and her colleagues provide the latest advancements in research and technology in treating sensorineural hearing loss, such as with lyric implantable hearing aids, Bluetooth-enabled hearing devices, and rechargeable hearing devices, as well as digital listening training therapy. Dr. Scarff and her team offer thorough hearing care for their patients that go beyond hearing aids, providing educational training and support, brain training, and hearing assistive devices to their patients. She's guided the Bowness Seniors Association and the nonprofit Carrie Seniors Organization in Calgary in setting up an innovative hearing aid recycling initiative since 2019 to assist low-income seniors to get the hearing aid devices they need to hear better. Dr. Scarff lives in Calgary with her husband, Brian, and their 2 children. Together, they enjoy outdoors at their cabin in Fernie, BC, where they hike and mountain bike with their dog and enjoy traveling internationally to see sights and enjoy new cultures when they are available. Dr. Scarff, thank you for joining us today. We're hearing more and more about the importance of good hearing health and how hearing impairment can affect one's physical and mental health. What are the facts that we do need to know?
Thank you so much for the lovely introduction, Colleen, and I'm so happy to be back with the Kirby event again this year. I always like to take part in it, whether it's in person or by Zoom. There are lots of facts we're going to go over today to answer your question, and I think it's really important, well, I believe it's very important that these facts are shared in a very accurate way to people. And just to kind of give the audience a little brief update about what's going on with me. Sadly, I had an accident on the weekend, so I broke my leg in multiple places and had surgery a couple days ago. So that's why you'll see my couch behind me and my plant behind me. I'm at home with my casted leg up. So, but I believe so much in sharing this information, accurate information about hearing loss with you, that I really wanted to make sure that I went ahead with this seminar today. I didn't want to miss it. And today I'm not going to really take questions. I'm on some medication to help with my pain, so I'm not perhaps quite as alert as normal. I'll do my very best to share as much information as I can. But I invite you to email us, and there'll be an email at the end of the presentation where if you do have some questions, we'll be happy to get back to you just in a specific way to your particular question. So thanks again for having me. And I want to just show the audience a little bit about who we are, my team, because I believe that we can do a lot of things with a team that we can't do just alone. So although I started this clinic about 20 years ago now, I have a wonderful team who help me share my vision of hearing health, where I believe it's not just about a pair of hearing aids and a hearing test and letting people go on their way. given my background, having a PhD in auditory science, I know there's so much more to audiology and the auditory system that we can share with our patients to really make a big difference in how their hearing functions on a day-to-day basis. So as such, I've gathered just really, truly the leading clinicians from all over the world to work with me on my team. And you can see some of them here. We have Jessica, who has come to us from South Africa. She has a lot of experience there. Laura, who's in the top left corner there, who's come to us from Bermuda. She trained in Canada, but she's originally from Bermuda. And then we have Alan Feldman, who's originally from Toronto, but joined our team, gosh, he's been with us for about 6 years now. So wonderful team. And we also have Allison in client care. So if you do end up needing help with your hearing, or you have someone who you care about and you want them to get the best hearing care possible, they would probably speak with our lovely client care coordinator, Allison, and she would set up whatever's needed for them. So what are the learning objectives for today? I really want to share with you some accurate information, I guess, leading edge research, and I want to cut through the advertising clutter. I mean, I can't go for a day without, looking at my phone now, or, a newspaper or any kind of magazine, even a local community magazine, without seeing advertising about hearing aids. And unfortunately, most of that is simply advertising. It's not necessarily educational information. It's more on the marketing side of things. So I want to cut through that clutter and share with you the true updates in hearing health that are available to help you if you have challenges with your hearing. I want to talk about some interesting advancements in devices that can help you that go beyond hearing aids. I want to also talk about, like Colleen mentioned, preventing cognitive changes related to hearing loss. So there's a lot of research to show if we have hearing loss and we don't do anything about it, we're putting ourselves at higher risk for different cognitive changes. So we'll talk about how to prevent that. And I also want to mention when and how to get thoroughly tested. So we'll go into that in this presentation. So why we do what we do. So in case you don't know, so some of you might be my patients. Hopefully I've told some of my patients about this presentation, but if you aren't and you don't know me, you may not know that I myself have hearing loss. I've grown up with hearing loss in my family. So, I understand some of the challenges, and I really want to devote my career towards minimizing the barriers. So if someone has hearing loss and wants to hear better, that we can help them. We can reduce some of those barriers by educating them. I believe education is the key to success. Oh, and I should mention, the other reason why we do things that we do is because we care about people. Every single one of my team members has a connection with someone in their family or their friends who has a hearing loss, and they followed up in their career and went to the educational extent that they did to help those people. And they're very caring people as well. So I showed a few pictures here of myself because I have hearing loss, and then my son, who's starting to show early signs of hearing loss too. So why is learning about hearing loss important? First, I want to say, if you have hearing loss, you are not alone. And I think this is maybe the most important take-home message you can get from this presentation. A lot of people start to notice their hearing loss maybe around age 50, certainly by age 60, and they don't realize how common hearing loss is, and that probably many of the people they know, whether it's their neighbors or their colleagues or their family, actually have some hearing loss as well. So you may or may not know that about 20% of adult Canadians have some hearing loss. And it's not just a little bit, it's enough hearing loss to affect their ability to hear and understand speech correctly. So this is an important statistic to just kind of keep in the back of your mind. Now, here's some other really important statistics. Almost half of Canadians over age 60 have hearing loss, almost half, 48%. And one thing I like to point out, because I have some patients who've, gone to see maybe physicians, maybe other healthcare professionals who aren't as aware of these statistics, because these are quite new. These are from 2013, 2014 Canadian longitudinal health study. And so not everyone is quite as aware of these statistics, and they might say to you, oh, your hearing is normal for your age. Yes, you have some hearing loss, but it's normal for your age. And what I like to say is, no, although it's common for your age, it's certainly not normal. And if we have the opportunity to improve your hearing, and there's all these other links with good brain health, then normal for your age is not good enough. Now, here's the other statistic that's very, very important, is that although almost half of Canadians over age 60 have some hearing loss, in that same study I referred to, 70% of those people who showed some hearing loss on their test results were unaware that they had hearing loss. So that's why learning about hearing loss is so important, because people are generally speaking unaware that they have some hearing loss. Hearing loss is usually gradual, and so we don't necessarily know what we're missing. If we haven't heard something, how would we know that we've missed it? Or if we hear something incorrectly and we mistake one word for another, how would we know that what we've heard isn't correct unless somebody else points it out to us? So listen to those people around you, your family, your friends, your spouse, if they're mentioning these types of things. The other reason why it's so important to learn about hearing loss is because it can be preventable. It's important for us to treat hearing loss sooner rather than later, because it can get worse if we don't. And that is, again, tied to our brain health and how well we understand what we hear. And finally, of course, quality of life. And Colleen mentioned this. We want everyone, at different points of our life, to have the best quality of life possible, to live their best life. And hearing gives us, and sound gives us richness to life's experiences. So communication with our family, with our friends, sounds in our environment that we enjoy, whether it's music or, the sound of our dog snoring or breathing or cat purring. Those are important qualities that really add to the richness of life. And so we have some on this screen. Every time that I open a clinic, so I have 4 clinics now, and every time I open a clinic, I ask the staff what some of their favorite sounds are, because I think it's really nice to share that with our patients, to let our patients know that it's not just about something that we've lost, a hearing loss or a disease, but what we're trying to do is to turn that message around and say, let's see what we can gain back. Let's see what we can enjoy with hearing better again. So why do we need to identify hearing loss early? Because like I mentioned, people are not aware of their hearing loss. Up to 70% of people in that study, a large scale Canadian study, were unaware that they had hearing loss. On average, people tend to wait 7 to 10 years before taking action. And this is not good. It relates to some changes in the brain that we could avoid if we took action sooner. There are also related health changes that can occur with hearing loss, and vice versa. So if we have cardiovascular disease, if we have diabetes type 1, if we've been exposed to cancer treatments, so ototoxic treatments, we can actually be putting ourselves at higher risk for hearing loss, whether we know that or not. So those are important points to know in your general overall health. If you have any of those health concerns, you should probably get a hearing baseline evaluation. On the other side of the coin, if we have hearing loss and we haven't done anything about it, we are putting ourselves at higher risk for dementia and cognitive changes. And there's a very critical, important 4.5-year window. So what do I mean by that? There's research from Johns Hopkins Medical Center that shows if we have hearing loss and it has gone on for 4.5 years or more, our brain actually doesn't have the same amount of activity when our ears pick up sound after about 4.5 years. So even if we were to help someone with hearing aids, let's say at 6 years after they've started having hearing loss, we're not going to be as successful as we would have been if we did it earlier. Hearing loss, untreated hearing loss, is also linked with higher risks of depression, particularly in seniors, I think at about double the rate of average, and certainly a risk of falls. Colleen and I were joking around because I had a little fall on some ice, and she said, "Oh, I should have joined in the Kirby Center presentation about falls," but sadly, my fall was just a fluke accident outside. All right, so hearing loss and dementia research. Colleen also mentioned that at one of the presentations at this year's virtual fair, some of the presenters were talking about dementia, and more healthcare professionals are learning about this link between untreated hearing loss and dementia. So I'm really glad to hear that, there's momentum in getting that message out there. So what do we know about this link between having hearing loss and not doing anything about it and putting ourselves at higher risk of dementia? In 2017, the Lancet, which is a very well-respected scientific journal, they put together a commission research publication. And what they were doing was trying to look to see what the highest risk factors were for dementia, as well as different rehabilitation manners to improve dementia and look at different outcomes. And what they found was there were about 9 risk factors that were modifiable that could affect your risk for dementia. And what was interesting and perhaps surprising to the researchers and to the general public and people in science publications was that untreated hearing loss was the highest modifiable risk factor for dementia. So people were quite surprised. They thought, why is it that, if we have hearing loss and we don't do anything about it, we're putting ourselves at higher risk for dementia? So we're going to talk about that in a moment. But here's the interesting thing is that the Lancet came out with an update about 3 years later. They found a few more based on international research at different respected institutions. They found a few more high risk factors for dementia, things like air pollution, head injury, things like that. But they reconfirmed that untreated hearing loss was the highest risk factor for dementia. And most notably, they said there's enough research now to believe or to expect that if we have hearing loss and we improve our hearing in whatever manner is appropriate, we can reduce that risk factor. So this was really important information for people like our patients who might come into us and have a hearing test and we identify some hearing loss, but they may feel like, oh, I'm not quite ready to do something. So this kind of research is critical to share so that they know, well, I need to start thinking about this more seriously and taking action sooner rather than later. Okay, let's take a look at why adults with hearing loss are more likely to develop dementia. So it's not that, hearing loss is any particular disease process that causes dementia. It's no magical disease. But there are a few reasons why we think that hearing loss is so highly linked with increasing our risk for dementia. Number one is actual stimulation. So if you think about a muscle, we have to exercise a muscle to keep it strong, otherwise it atrophies. The same thing holds true with the auditory cells at the brain. So if we aren't picking up correct sounds at the ears, we aren't having that stimulation at the brain, those cells actually atrophy and either die or go on to do other things that aren't related to hearing. And so if we try to improve the sound situation, with hearing aids or making sounds louder by turning up the TV, the brain cells aren't there to make sense of the information. The other important reasons are that social isolation is linked with untreated hearing loss. So when people start to have hearing loss and they often start to lose their confidence about being in different environments with people, particularly social environments with groups of people, like playing cards or going to a restaurant or things like that. And as they start reducing their activities in that kind of domain, social domain, they end up withdrawing, they end up being socially isolated. And we've known for the last 30 to 40 years that this is not healthy for the brain. And then the last reason why adults with hearing loss are more likely to develop dementia has to do with cognitive energy. So we have a certain amount of energy at our brain to do all the multitude of things that our body needs to do, whether it's breathing, whether it's planning, whether it's moving our muscles. But it also comes into play for hearing. And if we're in a challenging listening environment, perhaps where there's lots of noise, our brain has to work a little bit hard to help us listen to what's going on. If we have hearing loss, our brain has to work extra hard all of the time to try to use the context of what we're listening to figure out what's being said, to try to filter out background sounds if there's noise around, etc. So If we have hearing loss, we have to use a lot more of our cognitive energy, and this can make us actually quite tired, but it can also be, it's also one of the risk factors for dementia. All right, so why do we get hearing loss? There's a number of reasons. However, I will tell you the most common reason has to do with those little, that picture of those little hair cells there. It's called the outer ear. Sorry, it's called the inner ear. Hair cells are lining that little purple structure called the cochlea. That's called the inner ear or the cochlea. And those hair cells wear down over time. Think about, every time we hear a sound, hair cells move back and forth, okay? They send the air pressure, essentially, back and forth to the nerve, which goes up to the brain. So they're working all day, they're working all night, whether we're awake or not. So they wear out over time, just like the tread on our tires. The more that we drive, the more that those hair cells wear out. In terms of hearing, the more that we're exposed to sound. So if we're exposed to a lot of loud sound, they will wear out more quickly. So that's why it's important to protect our ears from loud, sustained sounds, like, for example, in a factory, if that's where you're working, or even with a hair dryer. If you use a hair dryer every day right by your ear on high, I suggest you wear hearing protection, just earplugs, to prevent those hair cells from wearing out. But they do wear out over time. There's nothing we can do about aging and the wear down of those hair cells except protecting ourselves from loud sounds. So the fact that these little cells, hair cells, are the most important part of the most common kind of hearing loss pertains to the next important bit of information that I want to share with you that's really exciting. Since I trained about 22 years ago at university, when I was doing my audiology degree, we've been looking, and for even longer, we've been looking at ways in science to regrow those hair cells. We are, finally at the place where we can do that in humans. We have done it in avian species. We're finally able to do it in humans. Different institutions in the United States are working on longitudinal studies to see how effective we are with this. Essentially, what happens is we send in some molecules into the ear, into the little support cells that are underneath those little hair cells, and we tell them, we force them, or we explain to them to develop themselves into new hair cells. And so this is something really critical in the world of auditory science. It's the most important finding I can share with you today for two reasons. Number one, it's exciting. In the future, perhaps you'd be able to come to someone like myself. I can inject these molecules in a liquid into your ear. They would go across the eardrum and get into your inner ear and regrow hair cells. That's number one. But number two, which is most important, is what we're doing today, if you have hearing loss, is going to allow the preservation of the cells at the auditory cortex to use information from those hair cells if we preserve the auditory cortical cells. So it's just critically important that if you have hearing loss, you receive treatment sooner rather than later to keep those auditory cells working. So if we can improve the hair cells, the message will get interpreted by our brain. But it's also critically important that we use all manners available to preserve our auditory function and stimulation. And I'll give you some tips and techniques to do that at home in the next couple of slides. So like I mentioned, if you have hearing loss, I believe you must keep your auditory system properly stimulated to be able to take advantage of these scientific improvements in the future, such as hair cell growth, such as who knows what else will come down the pipe in science. Otherwise, you're really putting yourself at a disadvantage as to the fact that you wouldn't be able to use these scientific advancements in the future. So just imagine if you have hearing loss and you have pretty significant hearing loss and you don't do anything about it. And remember that research I showed you where the auditory cells atrophy after about 4.5 years. Okay, so let's say you're just living your life. You say, oh, I have some hearing loss, but I'm not too concerned about it. My doctor said it's normal for my age. So you're living your life, you're going about your day-to-day activities. And then 10 years from now, we have the ability to improve your hearing with these scientific advancements, regrowing those hair cells that we know have been damaged in your case of hearing loss. Well, you wouldn't actually be a candidate for that, because even if we improved those hair cells, your brain wouldn't understand the sounds correctly. It would just sound like a bunch of noise. And this is actually similar to what happens with people who wait a long time to get help with their hearing with hearing aids. So if you know people who've done that and who don't have great success with hearing aids, maybe they say, I put on the hearing aids and they sound very noisy, or I hear lots of background sounds. It's no different. It's because they waited a long, long time to improve the hearing at their ears. And so their brain isn't really that capable of making the best successful use of the new sounds from the hearing aids. Okay, so how to get thorough hearing testing. Remember that the audiogram is simply a starting point. It tells us how you hear different beeps, different tones. Think of the piano keyboard, there's different keys. So if if you want to walk around and know what beeps you can understand and hear, then all you would do is you would get an audiogram test. And a lot of times, some of the free tests that you'll see on the bus benches and at big box stores, that's what they're looking at, that's what they're doing. They're doing a screening test. But in my view, hearing, and in the view of science, hearing function is much more than how well you hear beeps or tones or piano keys. We need to understand how well you function, your hearing functions in the real world, and for that we have to look beyond the audiogram. Okay, so further investigation, further thorough testing is crucial, and that's why we practice something called family-centered care. I alluded to the fact that hearing loss is gradual. Remember, those hair cells wear down over time. So it's often very common that people don't notice their hearing loss as much as the people around them do. So when we perform a hearing evaluation, we strongly encourage our clients to bring in a communication partner, whether it's a spouse, whether it's a friend, whether it's a family member, somebody who is aware of how they are hearing in their day-to-day life. And that's a critical component of having a thorough evaluation of your hearing. We do other really important tests to determine how well you understand what you hear. So we do speech testing, because like I mentioned, we don't walk around listening to beeps. We walk around listening to music, which is more complex. We walk around listening to conversations and dialogue, which is much more complex than just a beep or a tone. We also test how well you listen in noise. That's the number one reason why people actually come into our clinic, is because they start to notice that they're having difficulty listening in noise. So it's I would say the first symptom that a lot of people will report of their hearing loss, whether they notice other things about their hearing loss or not. So if that's something you're noticing or someone you care about is noticing, they should come in for a test. And by all means, it doesn't make sense to go and get a basic audiogram screening test that doesn't test how well you listen in noise if that's the only thing you're noticing about your hearing loss. So that's why we've implemented that in our hearing testing, and that's based off of international research, mostly in Australia and New Zealand. And I should mention that our brain changes over time, whether or not we have hearing loss. After about age 35, it becomes harder for us to process or basically understand sounds, particularly if there's noise around. So you can imagine, once we have hearing loss and we're over age 35, it becomes much harder overall. So that's why it's so important that if you go for a hearing evaluation, we do all of these thorough hearing tests. Okay, when should you get evaluated? If you experience these following things repeatedly, then you should definitely go and get your hearing tested. So asking people to repeat frequently, turning up the TV or radio louder than others frequently, or if your family member comes over and says, oh, your TV is blaring, that could be an indication as well. Difficulty hearing people if they have their back turned and they aren't facing you. Feeling like other people are mumbling. Difficulty hearing in background noise or understanding what's being said in background noise. Common tinnitus, ringing or buzzing in the ears. And really everyone over age 50 should have a hearing test baseline. We had a gentleman who, he was actually much younger than this. He was in his early 40s, and he was just one of those guys who takes his health care seriously. He gets his eyes tested every year. He got a baseline hearing test. And it was so fortunate because he had a workers' compensation accident at his work where he actually slipped under his vehicle, hit his head, and now he has significant hearing loss. And because he has that baseline test, WCB covered him for his hearing care for the foreseeable future. So that was very, very fortunate. You know, we get our eyes tested every year, but we don't often think about our ears. And it's a really non-invasive, easy test. You might learn something that you didn't know about, you know, even if you have normal hearing, about hearing protection and prevention, about protecting yourself from loud noises. You might learn something that you can share with someone that you care about who does have hearing loss. So getting a baseline test by age 50 is a really good thing to do. There are some new COVID-related symptoms we're seeing. You know, people are at a distance a bit more, and certainly people are wearing masks or behind plexiglass. So if you're noticing that that is being more noticeable, your hearing challenges are a little bit more noticeable, perhaps it's time to get a hearing test. So when is it time to take action on your hearing? Like I mentioned, half of Canadians over age 60 have difficulty hearing speech correctly. If you're one of those people, it's time for you to take action based on all the research that we've seen, linking it to brain health and cognitive changes and dementia. Now, the hearing loss is usually in the high frequencies. And so what happens is you won't feel like you can't hear anything at all, obviously. You'll feel more like you can hear but not understand quite correctly, or like things aren't quite as clear as they used to be, and that you need to use a little bit of extra effort to listen. So those are the things to bear in mind when you're thinking, okay, maybe I should go get my hearing evaluated. And once you do have it evaluated, to consider doing something to improve your hearing. What can we do to address hearing challenges? So there's lots of technology out there, and this is our area of expertise. If you need help with your hearing, we'll talk to you about all the different options based on your lifestyle. If you're the kind of person who's super active and wants to go biking with your spouse and hear your spouse when they're road biking ahead of you, there's special devices that can help link up your hearing aids to your spouse's voice, a little microphone. I use it with my son when we go biking. If you're more, if you're, sitting around the house a bit more and watching more TV, then there's some devices to help with the TV, for example. All sorts of devices, but we have to determine what is going to work for you. One of the two of the really neat improvements or advancements in hearing aids. So, every month you'll see advertisements about hearing aids that can do this and that and the other. I will say, and true advancements happen about every 2 years. And some of the most useful ones that I'd like to share with you include the fact that because some hearing aids are Bluetooth compatible now, if you lose your hearing aid, and this happened to my patient, you can actually go on your phone and you can find your hearing aid. So that's a huge advancement because hearing aids are small, and especially with masks, sometimes they get dislodged from your ear. So he was able to just use his app on his phone. We showed him how, and he was able to find his hearing aid that he thought he had lost. So that's a really big advancement in kind of the function of hearing aids. Remote care also. So, it's harder and harder for people to get out sometimes as we get older, or for example, me with my broken leg, it's going to be very hard for me to get out and about. So one of the things that we do with our patients who have mobility issues is we can link up to them remotely and we can make adjustments to their hearing aids. So that just makes things more convenient for them as well. And then another really nice advancement is the rechargeable hearing aid advancement. So instead of having to worry about tiny little batteries that you have to change and see, and sometimes you drop, and if you have pets or grandchildren around, they can be very dangerous. We now have rechargeable hearing aids that we just pop into one of the cases you can see at the bottom of the screen there, and pop them in there overnight, and they're ready to go the next day. So just much like your phone. So lots of improvements, advancements in hearing aids, but I want to tell you that hearing aids are only one part of what we can offer you to help you with your hearing. So what else is there to help you? Many, many things. Like I said, consider hearing aids as the starting point. And depending on what we discuss with you at our interview, our family-centered care interview, we may find that, there's another particular environment where we really need to address the environment with a device. So I'll give you an example. There are these wonderful microphones that you can either clip on, your spouse can wear, or you can wear, or we have a lady, or you can put it on the table at a restaurant. And it's a very powerful microphone. It's directional. It picks up from whoever's talking, and it sends their voice directly to your hearing aids. So these are called remote microphones. I'll give you an example of how we helped someone with this, with her very specific but important need to her. So she has young children. They sit in the back of her minivan. She has a lot of hearing loss. Although she wears hearing aids because she's facing forward when she's driving, as she has to, and hearing aids are generally designed to pick up more from the front than the back, we set up a microphone right above where her kids are with Velcro in her minivan so that she can hear them nicely in her hearing aids without having to turn to the back and make her driving unsafe. So lots of different kinds of ways to use these devices, and we love to be creative and find ways for people to use them to make their hearing function just that much smoother and easier and be less work for them. So then there's also some great rehabilitation options. So there are some speech to text apps that you can get if you are having trouble with people behind plexiglass at stores. For example, you can get a speech to text app on your phone. And basically what you do is when someone is talking, you just point the phone towards them, towards the plexiglass, and then the app on your phone will just translate it into text so you can read it, so you're not missing any of the words. A lot of them are free, others have a small fee. I suggest you try out a free one and see how it works for you. Listening training and brain retraining is now a really interesting area of research. There is starting to be enough studies to show the best ways to do it to have the best success. So there's specific listening training programs. And we know from research from different universities, but particularly the University of Toronto and the University of Washington, that if we train our brain just simply with listening training, it's just like doing exercises. We can actually get our brain to recognize the difference between different letters more accurately and more quickly. So there are some different brain retraining programs, and I'm currently looking into that. It's something that in 2022, I'm going to be trying with a group of 5 patients, 5 test patients. So if that's something that you're interested in getting involved in, like I said, I'll have my email at the end of the presentation. And yeah, it's all you would need is either a computer or an iPad or a laptop to do this listening training program. Okay, so other things that can help you if you have hearing loss beyond hearing aids, definitely assistive devices. The best place to go for these are the Deaf and Hear Alberta Association. I put their website below. They are a nonprofit agency. I was on their board of directors for over 10 years. They have great supports, whether you need a shake awake alarm clock, whether you need something just simply for the television. But there are accessories that can work with hearing aids. So if we see when you come into us that, hearing aids might be the starting point of what's going to help you, but maybe you need something else to help you, we'll refer you over to the Deaf and Hear Alberta Association. They also have wonderful resources for patients. They have some peer support programs. So if you're new to hearing loss, they have other people who have had hearing loss a long time. They can link you up virtually. They'll give you support and tips. They have all sorts of different programs. So I really highly recommend, if you don't know about them and you have hearing loss, you should visit their website. They have wonderful resources for patients with hearing loss. Okay, so what are some important tips for preventing cognitive changes relating to hearing loss? Get tested. If you're over 50, if you have 2 or more of those signs or symptoms, or if you're simply feeling like things just aren't as clear as they used to be, get tested. Once you're tested, if the audiologist shows that, yes, you have some hearing loss, consider treatment. We want to help you hear better, have better hearing function now, but more importantly, we want to preserve that brain function for the future. If you already have hearing aids, so if you're one of my patients, keep your hearing and listening skills working. Wear those hearing aids consistently, even if you're at home alone all day. You'd be surprised how much sound there is around your home, maybe birds chirping outside, maybe traffic going by, but even your heartbeat and your footsteps, that's good sound for your brain to hear. And if you're not hearing those sounds because you're not wearing your hearing aids, then when you go out to the real world, your brain gets really overwhelmed by all the little sounds. Whereas if you're wearing the hearing aids when you're at home, your brain is already used to certain little sounds and knows how to filter things out. Adaptation to hearing aids can take quite a long time. So when we have hearing loss, we have to give it time for our brain to get used to understanding the sounds that we're hearing with the hearing aids or whatever devices we might recommend for you. So consistency is key. Like I said, wearing them every day, all day, very, very important. And I like to use the analogy of learning a language. If you're immersed in that language, you're going to be far more successful. You're going to pick up the language more quickly. You're going to get the accent more accurately. So for everyone, whether you have hearing loss or not, whether you wear hearing aids or don't, you should be stimulating the auditory system by listening to music, listening to podcasts, speaking on the phone or Skype or Zoom, having conversations, watching movies, watching YouTube presentations to learn new things, listening to audiobooks. Don't get used to silence. That's the worst thing that we can do if you have even a little bit of hearing loss. We need that brain to be stimulated. Think of it like a muscle that needs exercise. And then I like to put together this tip sheet and share it with patients. And if that's something you'd like me to email you, you can email me. We can either pop one in the mail for you or just send it by email. We have a digital copy. It talks about different tips for communication. If you've got a little bit of difficulty with your hearing, again, whether or not you wear hearing aids, this can help you. This can be a game changer. My top tip for people who are speaking with you, if you have a little bit of hearing loss, is for them to get your attention before they start talking. Because remember, we're talking about hearing with our brain, but understanding what we're hearing, listening and focusing and interpreting with our brain. So hearing with our ears, listening, interpreting, focusing with our brain. So if somebody can get your attention and your brain can switch from what it's doing, maybe reading the newspaper or reading your iPad, to listening, you're going to be far more ready to anticipate what's being said, and you're less likely to have a communication breakdown. So number one top tip for communication is to get people to get your attention before they start talking to you. I will tell you, once they start doing that, they will automatically face you. And that's the second tip, is have them face you. But if they simply try to get your attention, they're automatically going to orient their face and their mouth towards you. The top tips for you trying to help yourself: number one, use closed captioning on shows that are recorded. Any kind of pre-recorded show like a drama or a comedy. Closed captioning is not as effective with the news, but generally the news is only one news person speaking at a time, so it's not as hard to follow. But dramas and comedies have music and lots of people talking at the same time, so closed captioning can be your friend. And that's usually just in the menu in your settings of your phone or of your remote control. And then also be an active listener. Lean in and listen to what is going on in the conversation. Think of the conversation like a tennis ball and just kind of watch that conversation as it's going through your conversation. Okay, so lots of information about hearing aids. There's plenty of programs to help people out there. We help you if you're on a low income, get on those programs, because hearing aids are a big financial investment. We've never turned anyone away. We even help people with a special hearing aid recycling program through the Boness Seniors Group. I would say, be sure that if you need help with your hearing, get the proper care that you can. The clinic you go to should offer all of these things that I've been talking about. And these are things that we do at our clinics. You can self-refer to our clinic. We do charge a fee. It's often covered on your health insurance plan. If you're a senior on a low income, you can let us know that. If you're on the special Alberta Aids to Daily Living program, we can waive that fee for you. So yeah, I just want to finish up by saying we're your partner in hearing healthcare. And hearing healthcare, should really be more than just a set of hearing aids and a hearing test. It should be about education, support, leading edge research, and a team that's going to be there for you. So you can find us at a number of different locations in Calgary. The most important thing, if you want to follow up, if you have any questions, is you can email us at info@audiologyinnovations.ca. You can also check out my web page, which has a lot of good educational information, audiologyinnovations.ca. I do have a YouTube channel as well with lots of videos about specific things related to hearing care, hearing aids, different devices. And like I mentioned, we learn things from our patients. So please contact us. Feel free to contact me with questions. And yes, I do a great e-newsletter. So I put together educational information. I send it out maybe once every 2 to 3 weeks. If you're interested in that, all you have to do is email us at the info@audiologyinnovations.ca. We'll get your email on there, and then you'll have access to all that as well. It's all educational versus advertising based. So please take advantage of that. I think now that you've watched this video, you know that I'm someone who's trustworthy and has a lot of background in auditory science. So the information I provide to you is high quality and information that should be able to help you. And I'm more than happy to help you. So I say thank you very much for your attention, and I'll turn it over to Colleen.